bari man fin kankura wala manyo bito hani fa kaseboyo nte kadi ture mbina lalije ka kuwal natale mungu buka ado ni chosano la kuwala aninga men talent tv ado ni chosano tamabulale koteke albulan noma kona fale nyame arabo arabalo ado ni chosano aninte ture muso fen tamabula koteke
WhatsApp, the platform is taking action because there's a lot of global misinformation, especially on this pandemic, not just in Gambia. So I would like to thank, the managers and owners of.
Aka kenu nyameng ñinum programme ti mum dina la Gambian Talents TV arabo araba ka botala nani foka jitala luluka nin ko aka kenu nyameng ñi ado ni ciosano le fere nin ko ado ni ciosano akita ko mu yanu ka mabotale nañu jamano molo mu yalon ko fa ya ado ni ciosano lo mbake molo mu yalon ko fana ya ado ni ciosano lo bari man fin kankuran wala maño bito hani fa kaseboyo nte kadi ture mbina lalije ka kuwal natale mungu buka ado ni chosano la kuwala aninga men talent tv ado ni chosano tamabulale koteke albulan noma kona fale nyame arabo arabalo ado ni chosano aninte ture muso fen tamabula koteke
Yeah, it's your boy One Pack, you get me? Sen hol xalaat yu bonne nañ ko sànni fele si mbalit gi nele xale ndaw yi toog di ko foye fele door leen di seetaan Gambia Talent Promotion, you get me? They promoted only Gambians and this is our own thing, Gambia, you get me? Suma fansi soo leen ma bëggee gis boy fii rek la boy si hot platform bii la boy, yeah? You get me? This is how we do it. Soo leen bëggee gis lu xew si dëkk bi ak lu warul si dëkk bi TV bii la fii la fii fancy and am the jama yi ak haters. Welcome to Gambia Talent TV show, you get me? Sen hol xalaat yu bon nañ ko sànni fele si mbalit gi ne li xale ndaw yi toog di ko foye fele cause Beppa TV bu nekk si tundi Gambi gi Gambia Talent TV mooy seeni baay man One Pack maa ko wax ku ko dinaay nga def leneen comme gars yi ñu ñooy defee yaa ngi understand ñun ñoo fi ñëw xoolal di régler lu fi manqué di mutal lu fi manqué di def lu fi kenn deful
aka kenu nyameng ñinum programme ti mum dina la Gambian Talents TV arabo araba ka botala nani foka jitala luluka nin ko aka kenu nyameng.
Good evening to all of you and thank you for coming. We are here again gathered at the quadrangle in Banjul to give you an update by the ministry, and this is normally done by the Honorable Minister of Health, Honorable Ahmed Lamin Samate, but today is going to be read on his behalf by Dr. Bitey, who is the Acting Director of Health Services. So we will now allow Dr. Bitey to come and read the statement on behalf of the Honorable Minister, and then followed by the question and answer session, and then from there we can disperse. So thank you for coming once again, and then we're also sorry for the delay, but we do hope that we'll adjust the time, and then we will definitely work according to schedule. As you know, sometimes we have some technical issues here and there, but those issues will be addressed along the way. So on that note, I now invite Dr. Musawa Bitey to come and give the statement on behalf of the Honorable Minister of Health, Honorable Ahmed Lamin Samate. Dr. Bitey.
Good evening, ladies and gentlemen. The Ministry of Health would like to update the public on the situation of our national response to the COVID-19 pandemic in collaboration with partners through the National Health Emergency Committee and the various subcommittees. The 18th National Situation Report, since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia, on the 17th of March 2020 revealed the following. One, the Gambia records no new laboratory confirmed COVID-19 case. As we speak, all 38 laboratory test results received from the Medical Research Council lab were negative for COVID-19. That makes it a total of 175 tests have been done so far. There is one inconclusive one awaiting confirmation. 6 new people have been taken into quarantine, and this makes the total to be 38 now. Since the beginning of the pandemic, the country reported a total of 4 confirmed cases, 2 of whom have recovered, 1 passed away, and 1 undergoing treatment. And currently, as I said, there is 1 probable case. It is important to note that all 4 confirmed cases were imported. The global picture, since 31st December 2019 and as of 6th April 2020, at 23 hours 49 minutes, a total of 1,343,367 cases of COVID-19 have been reported from 206 countries or territories. Of these, 74,613 deaths were registered, which gives a crude case fatality rate of 5.5%. The African region, as of 6 April 2020, has 46 countries reported 4,827 confirmed cases of COVID-19. Senegal, our nearest neighbor, has reported 226 cases now. The first set of cases in the affected African countries were all imported. However, now local transmission is on the rise. We hope the public and ourselves will continue to be vigilant and to call our toll-free number 1025 for advice and for sharing of information. Finally, I would like to take this great opportunity on behalf of the government of the Gambia to thank the people of this country for solidarity demonstrated during this period. I would also commend all health workers, communication practitioners, and the security personnel for the hard work and sacrifice you are doing for the people of this country. I wish to thank all the partners, government departments, the private sector, municipal area councils, as well as communities for the support and collaboration in our efforts against COVID-19. Together, we can make a difference. I thank you very much for your kind attention.
Thank you very much, Dr. Vitoy. Thank you, Director, for that assuring statement. As usual, if you have any questions, you may ask 2 or 3 questions, and we can discuss for the day. And your media organization, please.
Good evening. My name is Mutlan Karan, and I have just 2 questions. One is on the those at the border, because I read one story, I think this one was in Korea, and then at Angala they complaining that even the houses and the other use is not up to date. They're using the house that was built for the Ebola. So I don't know when the ministry will upgrade this. That is one. And secondly, the issue of the relief package. Earlier, sitting mode, I think sitting mode is in one of the committees. That currently there are discussions to see whether they will help those that are less privileged or people simply have the extension of the state of public emergency. So I don't know how far with those discussions and what we expect with regards to the data.
So I can tell you that it's part of the plans to upgrade the point of entries. And we've visited that place in Amdalai. Like you said, there are some issues with electricity and all. And I think GRA were kind enough to connect them. But the plans include upgrading the point of entries. And this has already been included in some of the things the World Bank is funding. About the restoration and to help the socially disadvantaged, I know I was privy to be in a meeting where Minister of Finance is working hard on that to ensure that if these things are done, if these measures are taken, there will be safety nets for those type of people. The government is looking into that, and budgets have been made, what it will take. The demographic studies have been done. They already have the statistics of people who will need those type of support and what it will require. So there's a plan to help that.
Thank you, Dr. Bite. I believe the director can elaborate because we are just coming from a risk assessment. They say about the border entry points, I mean, just as Dr. Bite hinted, and then they are being upgraded, but at least first-hand experience, latest information of what you've seen over the weekend. Maybe that
I think basically what has been said, that is exactly what is happening. What's just the plan is to, where we don't have points of entry, official points of entry, the plan is to have those areas to have official points of entry. Where we have is just to look at them, review, and then refurbish where necessary, and then also try to ensure that all the materials that are required are also provided. That is also in the plan. But currently also what is happening in Amdalai is that the team is working very hard with the team in Senegal. They're doing what we call cross-border initiative. And in this cross-border initiative, what they are doing, they're going into communities, because this is our health authorities and the health authorities of Senegal and the Gambia are working together to reach out to all the communities within the borderline, so that they also sensitize them, engage them, and also for them to take action, and to ensure that they also limit the movement of people within these two countries. So this is something that is also ongoing, and we want to thank the two countries for coming up with an initiative, a cross-border initiative, so that this has also been extended to other regions in the country. So basically, the plan is to, review the existing structures, and then to make sure that what needs to be done are provided. And if you look at recently, with the support of the IOM and as well as the ministry itself, we're able to provide some basic materials for those points of entry across the country. So this is something that you will see when you go. You will be able to see thermometers, you will see computers, you will see materials, PPEs, and any other equipment that they would require to protect themselves, and also whilst they are doing their work, you will see this thing by yourself, and you'll see the buildings are also of good standard. So what we need to do now, areas without official point of entry, the plan is to have those facilities built in those points of entry. So that's the plan for now.
Thank you. As Dr. Bite and the director said, and we are working on it, and what we've seen in the borders, at the official points of entry, we have isolation centers. And the challenge is not the official boarding center. The challenge we've seen is the unofficial boarding center, entry points. As we know, Gambia borders are porous, which means that we have to appeal to the community to be vigilant and help us. We've been to Sabi, for example. They have identified 8 unofficial entry routes, so people can still carry people in motorbikes. And we have to understand that as long as Senegal continues to register cases, Gambia, we are not free. And that's very important, So, and this is a collective effort. And I would like to thank Dr. Bite and the director for that elaborate response. And if you have any additional questions, you may ask. Anyone? You're all satisfied for the day? Doctor, you want to add something? No. Okay, director.
No, just basically, the ministry will still continue to work with the media. And then as we are saying, if we hear something, we just need to work together to address. For example, right now, what we are now doing, we are trying to, assess rumors and trying to find out who are the people who are sending out these rumors. We will identify them and we'll engage them so that we can also be able to find the best way, the best solutions. And then really, we need your support in that area, because without your support, we will not be able to track some of those rumors that are really been happening, being done at community level. For example, people are preparing audios, sending out to the public, so causing confusion, unnecessary panic, and so on. So we'll need your platforms to help us to counter those rumors. This is something that we have to do it together. So we need your support in that area. And also, if you want to visit any of the facilities, as Minister said the last time, you are free. You can just consult us. We can sometimes make arrangements for you to go and make your own, because of findings about a place, come back and give us recommendation, and we can also be able to implement those recommendations. We would really want you to do that for us. We need to work together in partnership, in collaboration, so that we can also be able to fight COVID-19 in this country. Together we can do it, and I think this is possible. So I thank you for coming, and we do hope that we'll be giving you regular updates, and we have some plans, but we'll share with you tomorrow to see what we can do, and so that we will also avoid the movement here and there. But there are a lot of plans we have, so that we can share with you. We can share those plans with you, and we can get your approval for that. So we thank you for coming, and then I will allow you to do the closing.
Thank you very much. As you said, it's very important for us to work together, and I would like
aka kenu nyameng ñinam programme oti mum binalale Gambian Talents TV arabo araba kabo talent nani foka jitala luluka nin ko aka kenu nyameng ñi ado ni ciosano le fere nin ko ado ni ciosano akita ko walti mu yalon ka mabo tale nañu jamano molo mu yalon ko fa ya ado ni ciosano la mbake molo mu yalon ko fana ya ado ni ciosano la bari man fin kankuran la maño bito hani fa kaseboyo ntakadi ture mbina lalije ka kuwal natale mungu ka ado ni ciosano la kuwala anin Gambian Talents TV ado ni ciosano tamabulale koteke albulan noma kona fale nyame arabo arabalo ado ni ciosano anin te ture muso fen tamabula koteke